and you're not really able to help me as my doctor either. So, or,
The only thing, Nirmala, I can tell you, you have to increase medications that I can help. And unfortunately, with the poor tolerance of your body to the medications, I'm also sometimes out of options. The only thing we did not start with you last time I talked with you is Topamax, topiramate.
okay.
And you did not start it yet. This is only one medication last which I can offer you.
What is that one for?
It's for pain management.
I know, but when do I take it and how much and what?
If you're taking 20 milligrams at night, starting at night, similar all medications, and then slowly increase to the dose which you will be able to tolerate. It's an old medication that we typically before we use for seizures, but this medication decrease activity of neurons in the brain and including pain neurons, and then people will have less pain.
And what's the why the need to increase tolerance? What happens when you don't, your body doesn't tolerate it? What are the symptoms I'm trying to avoid?
As you know, we tried with you every single previous medications, you develop some side effects. That's a side effect present in every single medication. That's a tolerance, I mean how much you can tolerate depending on side effects that you develop for this medication. Remember, we started with you amitriptyline.
Okay, well, I guess my question is, what is it supposed to do, and what does it do that it's not supposed to do?
It's supposed to decrease your pain, but side effects.
In what way? Like, how does it actively reduce my pain? Can you? I like. I'm. I.
Central nervous system neurons. It's working on your brain to decrease sensitivity of neurons to the pain sensation.
That's what gabapentin does, right?
But it's working through the different receptors. Pain receptors are multiple receptors involved in the pain formation. And that's why norepinephrine working on one kind of receptors. Lyrica gabapentin working on another kind of receptors.
What if it's mentally driven? Like it seems to be mentally driven in my case. Whenever I get worried about something, that's when it activates, right? It immediately goes to my legs in terms of the pain. So.
This is medications working on central neurons, whereas your mental capacity is coming from.
Right, but I mean, how do I counter this gabapentin seems to make it worse.
Okay, that's why we try to find something else, if something else will help you.
And we never tried this other one, pregabalin. You didn't seem to be too confident of that.
No, I'm happy with pregabalin. It's only one thing, can you afford it? This is a problem. It's a very expensive medication. I'm happy to prescribe you pregabalin.
How much is it? Do you know?
I believe 150 pounds per month.
And it's not covered.
No, it's depending on your insurance. That's why I can prescribe. You have to submit to your insurance. I don't know what coverage you have on your insurance, and then we make decision.
All right, and it has a chance of working. I don't know. Like at this point, I'm just going minute to minute, day to day. The pain level. I didn't think I was going to get through the night and the day today. It was that bad, and my right foot's been getting quite swollen. So the lady came this morning and manipulated my foot and put the sock on it. But like I said, I'm going day to day, minute to minute. I never know when I'm going to get AD, and it's just going to go out of control. Lately, I've been keeping track of my blood pressure, and the part that's disturbing to me is that the lower number is going up. So like I'll take the blood pressure, it'll stay around between 110/70 and say 70/50, right? and then it even goes down to like, you know, as low as 60/30. But then, and that's not so alarming to me. But then it jumped lately. What it's been doing is it goes, the lower number immediately jumps up to 80, and then it quickly goes up to like 120 or 130. I've had it recently up at 160/130, you know, 170/130, and it's really strange numbers. And you know,
This is typical unstable blood pressure in a person with spinal cord injury with your level. We do know that blood pressure can jump up suddenly in people with cervical spinal cord injury like you. But
right?
it's only, we have to worry if it stays for a long time, then it's worrisome. If it jump up, you change position, you relax, blood pressure going down. This is important. How long this high blood pressure stay?
Well, the other day it went for more than half an hour, and then finally I took a little bit of lorazepam. Usually it takes less than 1/8 of a milligram to get it to go down, and that's basically my only option at this point. When it gets to that point, is to take I just put a few grains really on my tongue, and it you know, I put like 1/8 milligram in there, but I actually spit it out. You know, as soon as I feel like it's had a strong enough effect, I don't want to have any. I don't know, but lately I'm just thinking I'm being stupid. I'm just going to take whatever I need to, and when I run out, I run out. That's because the doctor's not cooperating with me, and nobody seems to be working with me like directly on my medications. You'll consult with me and prescribe, like you said, the pregabalin or the topiramax, which I'm open to try either one, but neither of those really right now. When I have a severe amount of pain, I do a tiny amount of hydromorph. I told you how I microdose it, but I don't. But I stopped taking that when my doctor told me, oh, I won't go any higher than 20. He had reduced me to 20 a month because I was before being prescribed 30 a month, one per day, 1 milligram that is, and I started taking them at that rate, and then he told me, wait, I'm only going to give you 20. I reduced it because you weren't taking that many, and so then I just quit altogether. I was like, I'm not going to get into this game. So now I've just been struggling, and I took a little bit here and there, and but the pain is getting more, and at this point I'm done with like fighting, and I just want to go out and just you know, go out on my sword.
But when's the last time you took hydromorphone?
I took this morning. I took an 8 milligram.
You still taking it on a regular basis?
No, I took it because I had to put the socks on, and I wanted to. And the last few days have been like incredibly bad, so I started again. But for like 2 or 3 months before that, I didn't touch it.
How come you did for 2-3 months without hydromorphone? You feel bad? Good. You feel okay?
No, the pain was steadily increasing to now it's like it's not, you know, it's to a point where I haven't been able to do it anymore.
But then maybe you should increase dose of hydromorphone right now for the period when you're doing not well.
Yes, but then I need a doctor who's going to work with me. I don't need a doctor who won't speak with me. So I put in a.
Agreed that he will prescribe you 20 milligrams per day for months, right?
No, 20 milligrams per month. Per month. Yeah, per month. I just want a doctor who's sensible and will talk to me and work with me and do research, what other physicians are doing, what other processes are available, stuff like that. I don't have that. I put in a formal complaint. I wrote a formal complaint.
I organized a consultation with the chronic pain program.
Yes, and they wrote a recommendation to my family physician, and he just ignored it. So what was the point of all that?
I'm trying my best
Oh, you are. I'm not saying. I'm just saying what position I'm in. I understand where you're coming from. I'm just saying with my doctor the way it is, this is the way it is for me. You know, so I wrote up a formal complaint. I put it in with the supervisor over at my clinic. I don't know, she was the one that asked me to do it, you know, cause she's up frustrated as well with the way that he's responding to me. So I've, you know, I'm gonna keep letting it be, and my social worker too. I've CC'd it to him, and I should just CC everybody with it, and then I think I will. I'll send it again and CC everybody. But yeah, so I just don't. I don't have a vendetta against anybody. I just want good treatment. You know.
Let's talk about treatment. That's right. What I offered you two choices right now. If you can afford Lyrica, unfortunately, we have to consider if your insurance will cover portion or fully Lyrica covered. I'm happy to give prescription to you, send to your pharmacy, and then pharmacy will check with your insurer, and then we will figure out if you can stop Lyrica.
Okay, and the other thing I don't know how do I try something? If it with Lyrica, do I just like one day substitute all my gabapentin for a Lyrica?
No, we did not go there. That's right. Just before you will go there, first of all, we have to figure out if you cover. If you cover, then we start with low dose with all medications that you have right now. We will not cancel anything. We will start with low dose Lyrica and titrate it slowly to the dose where I know typically there is effect. And if you feel that pain is better, we can start to decrease gabapentin.
What about like right now? Even if I increase the gabapentin by as much as 5 milligrams, I get severe anxiety.
But we talk with you about gabapentin having two side effects with the high doses.
So I won't get that.
Tried it 2 times.
Okay, I'm just worried about getting that with the Lyrica in a really severe way, and then that's what I'm.
Okay, but we don't know until you will start. You're in pain. That's why I'm trying to offer you whatever we have right now.
Okay.
That's my recommendation will be following. I'm giving you prescription, and I will send it to pharmacy. You'd have to tell me again telephone number.
And what about the Topiramax? Should I try that?
But we cannot start at the same time two medications. We have to start with one. That's why I give you two choices. Which one you would like to start?
Amir, you're asking me. I know nothing of either choice. Which one do you recommend?
You ask me that I'm reluctant with Lyrica. No, I'm not reluctant with Lyrica. Lyrica is a good medication. Many of my patients taking Lyrica, and before starting topiramate, I usually will do Lyrica trial.
Okay.
I recommend to start with Lyrica first and to see how you respond. And then we will, if it's failed, then we will talk about topiramate.
Okay.
Lyrica, we're starting with 75 milligrams at night. After 3-4 days, you will add 75 in the morning. That's why on 150 milligrams, I would like to see you after 3-4 weeks to be on Lyrica with this dose. I would like to talk with you.
So 75 milligrams, what time?
At night, first of all, at night.
Like what do you mean at night? At what time at night?
Before going to bed.
Like not any specific time.
Whatever is convenient for you. Before going to bed, at the same time.
And what does it matter how much dosing of the gabapentin I'm doing, or just on top of it?
I told you, you're staying with the same doses. You don't change anything else.
Oh my goodness, I'm so frightened about this because is it a completely 75 milligrams could just like completely tip me over the edge.
No, you don't know, and this is the lowest dose available.
Wow.
Maximum dose of Lyrica 600 milligrams.
On top of what I'm taking with gabapentin?
So, yes. You take it with gabapentin until we will see effect of Lyrica.
Whoa, and what should be the effect? Oh my goodness. should it reduce my like thoughts, my fear?
It's not affect your emotions. It will reduce your pain.
Oh my goodness. And what are the adverse side effects that with this
Sedation, which is will be helpful for you to sleep.
What other do you have any like really severe reactions?
No, so far as I know, no. There is no allergic reaction significant.
Wow. Okay. I don't have a choice as I see it.
I'm happy to give you time. You read on the website what is lyric.
I don't really have a choice. I don't. My life's not going to continue
you
this
have.
way. No, I don't have a choice because in the sense that if I continue this way, it's not going to work much longer. It's really tough. I'm not even kidding. Okay, we'll give that a try.
Okay, can you give me a telephone number for your pharmacy?
Hold on. Six oh four
Yes, 604
733
733
632 no 5323.
5323.
Yes.
Correct?
So and hydromorph, like you said, my like and the pain clinic said what? Well, I guess I reported it in my report, and I've said it to my counselor, and I've done everything I could to try to get some cooperation with the doctor. That I mean, it's not like I want to take this stuff, but it does help when I'm in a dire state. I mean, what is the severe reluctance that I sense in most people toward having anything to do with it? What is it? Is that simply because there's been a stigma attached to it, or is it?
What? Opioids?
Yeah, exactly.
Yes, absolutely. Stigma attached, and that's which we experienced in Canada and British Columbia. It created all this negative impact on medical community.
Right. What about your particular experience with spinal cord injury and someone in my condition? And you must have experienced some pretty.
We prescribe opioids in acute period of SCI when they're in the hospital, and typically by discharge to community, about 60-70% will not require opioids. But the rest of the people sometimes do require opioids, and then it's managed by family physicians in community.
Okay, so that's a sensible approach. Sounds very sensible. And if I had a sensible doctor, then I would be okay, because I have other patients or friends, peers that you would consider patients in spinal cord injury that do the approach that you just mentioned, as well as others that have another approach where they don't use the opioids. I went into the acute unit at BGH on the higher floor you remember last year, it was like a year and a half ago, and I was there. When they discharged me, I was on a certain dose of the hydromorph. It was like 4 a day or something, and I was on. As soon as I was discharged, boom, I got no follow-up of prescription. The pain clinic was like, yeah, well, that's between you and your family physician. What can we do? Oh, we can send a recommendation. That's all. So then I was basically out the door with no hydromorph at that point. No follow up. So that's basically what happened in my case. I don't know.
I know, Nirmala. We talk about this, and I believe the only approach I'm recommending what is in my capacity, in my power.
Okay. I got it.
To did appropriate approach, you have to write a letter.
I did. I wrote a letter.
Write letter to the Ministry of Health. Write letter to MLA.
I wrote a letter. Yeah. I only have so much energy, but I'm doing my best. So
Okay.
and I'm speaking to you. It helps.
Okay, that's a normal. Next steps. I will call today to pharmacy. You will call them in afternoon. I hope they have your insurance number. And then they will check with your insurance, is it covered and what portion is covered.
Okay.
If
And
it's
how will
not,
I stay in touch with you in terms of transitioning? How long do I stay at the 75 milligrams before sleep?
already forgot what I told you. Already told you. You start with 75 milligrams at night for 3 days.
Okay.
After that, you will add morning dose. And on 2 tablets a day, one in the morning, one at night, it will be 150 milligrams. It's a very low dose still of Lyrica. You will stay for 3-4 weeks, and you will contact secretary to schedule the appointment at the end of November, beginning of December with me.
Oh my goodness. On top of the gabapentin.
You don't change any other medications.
Okay, and if I immediately experience something negative, what do I do?
You will stop it. If you cannot tolerate it, you will stop it.
Okay. And what have you experienced anybody in that condition that couldn't continue? No.
I did not.
Okay. Okay.
Any other questions?
I don't know. Oh. This is a crazy amount of whatever my legs go through.
Who is your family physician, Dr. Abu?
Yeah.
Okay, I'll dictate note to him. I'll explain again what we're starting, what we're doing. Okay?
Yeah.
Any other questions you have for me?
I don't know. I'm still frustrated with the way that I can't get anywhere with getting my family physician to, be a part of this team that I'm trying to use. And there's nothing you can do. There's nothing I can do. There's nothing the pain clinic can do. We're just all like, okay, just like Dylan can figure it out, Anyway, I spoke my piece. Okay. Thanks.
Okay, I will talk with you at the end of November, beginning of December, okay?
Okay. Thank you.
Bye-bye, Nirmala. Bye-bye.
Bye-bye, doctor. Bye.